Okay. All right, thanks for your patience, everyone. It being 2:05 on September 20th, 2023, I'd like to officially call the meeting of the Greater Boroughs Partnership for Health Advisory Board to order. First, actually, we got to do roll call for attendance. I'll state your name. If you could just say I am present. And Chelsea, you got to follow, you'll help me follow all the right rules, right? You live this more than any of us. Okay, so I'll start with you, Chelsea. Chelsea Malinowski.
Here.
Jennifer Sullivan.
Jen Sullivan here.
Heather Alker.
Here.
Anne Marie Muckenstrom.
Here.
Okay, great. And then we have additional staff and presenters on: Isabella Caruso, Erin Coulard, and Gabriella Knox. So welcome, everybody. I think we'll hopefully try to keep this a quick meeting. We have some updates, mostly going to hand a lot of this off to staff and a nice presentation from Gabriella. So we'll start off just quickly, the Public Health Excellence Grant. We did receive confirmation that the fiscal year budget and work plan were approved. So all of you had previously reviewed that budget and work plan, really no changes there. I think in general, remember our PHE budget originally was $300,000. After we did the CART process, they added another 160 or so thousand. And so with the extra funds available, we tried to take all of our great staff, or our Isabella in particular, and move her over to the PHE grant, because so that PHE grant now supports our 1.5 nurses and Isabella and Michael. So all staff that we sort of think of as like permanent, contracted, or town are now on that. So that was the budget we talked about before. So really no changes to that budget, and you all should have copies of the work plan. I know a lot of our health departments might feel a little upside down with some other priorities right now, but we'll be working through that work plan, and we're happy to circulate it again to any of you if you have questions. But we're ready to go. And it seems a little like anticlimactic because don't forget, like, we're obviously in the middle. We've already started on July 1 on this budget. We finally, very late, heard that it's all good to go. So good thing, because we were moving ahead. So it wasn't anything on our end. It was across the board. The state was just approving these work plans and budgets very late. If there's no other questions or any questions on that agenda item. Okay, great. We are going to, Isabella, we're going to go out of order to work with Gabriella. So Gabriella Knox is our intern from the Mass Department of Public Health. And she's been working with us all summer, and we even got some extra bonus time with her into the fall here. So we're going to take our agenda slightly out of order, and we're going to let Gabriella talk about food insecurity, which is a little later on the agenda. And so Isabella is going to share the presentation, and I'm going to go on mute, and Gabriella, hand it over to you and Isabella. Thank you.
Okay, hi everyone. Good afternoon. It's nice to see you all again. So I wanted to provide a brief update to the food insecurity project that I've been working on this summer. So if you recall, I was working on identifying existing hunger relief programs, both in the Greater Boroughs Partnership for Health region and also in Worcester County. And I'm happy to report that this summer I was able to compile a list of some really great resources, and I was able to conduct semi-structured qualitative interviews with each of the food pantries in the 4 towns. And I was also able to visit some of the food pantries and other organizations in the area to be able to talk to them a little bit more about the kinds of food resources that are available to people in the community. When I was conducting these semi-structured interviews, I focused on 3 kinds of areas of questions. So the first was demographic information. I wanted to know who is eligible to use the pantries and the food resources. The second kind of area of questions that I was asking regarded what kinds of resources are available here, like what kinds of foods are available. Are there fresh vegetables? Are there fresh eggs? How often can people shop here? So things that were focused on what kinds of food resources were available to these specific populations. And then the third part of the interviews were more focused on barriers to access, what kinds of things that they're looking to improve on, expand on, and then also how they can partner with local public health to be able to expand, whether that's expand access to the services or expand publicity for the services or getting the word out. Some of the findings that came out of these interviews was that all four pantries in all four towns, and everybody that I talked to reported that there has been an increased utilization of these food pantries over the last 12 months. In some communities, it was even up to 30% additional use of families and individuals using the food pantries and services. Another thing that we found was that there is a huge importance of client choice pantries. So all four of the pantries in the community are client choice pantries, meaning that people can come in and choose the foods that they wish to receive. They're not just given a bag of food that is, peanut butter and beans and pasta, but rather they're able to choose the different brands and the different selections that they would like. This has proven to be really important in food insecurity work because it reduces food waste and it promotes dignity and choice in people that are using pantries. And also, the food pantries also reported that food pantries are a significant source of a social resource for people in the community. So oftentimes people who are using the food pantries are not only coming to get their food and other resources, but are also going to interact with the staff and interact with the other clients that are using the food pantries. And that it's definitely an act of community to be able to go every week and meet up with friends and staff that are there. So it's definitely shown to be a significant social resource as well. And then coming up in the next couple of weeks, Isabella and I met prior to this meeting, and we talked about the comprehensive food resource guide that I've been working on. So I do have a draft that is coming through, and we will be working on it in the next couple of weeks. This food resource guide is going to have a list of resources that the community can use. It's going to have a map of grocery stores and convenience stores and other places that accept SNAP and WIC benefits for people in the community. It's going to have a page for older adults, people 65 plus, that points them in the direction of different resources in the community. And it's going to have a lot of other things in there that I'm working on. And so I look forward to sharing that with you all when it's complete. And thank you for having me this afternoon at this meeting.
Thank you so much, Gabriella. Does anyone have any questions about the food project?
So, I'm going to have questions. Now, Gabrielle, just thoughts on deliverables. What's your take on, were you thinking business cards with QR codes, or what are different ways you could envision that we could help to distribute this?
I feel like, so what I've been working on is similar to some of the food resource guides that exist in other communities. So kind of like an online booklet, I guess, of different resources. But I was also thinking, and I was talking to Isabella about this, to create some QR codes, especially for maps and links out to different resources that people can use. And I feel like some kind of, I think we talked about this in the past too, either a flyer or a postcard kind of style thing that could be posted up at community centers, senior centers, the library, something like that, that maybe will even have a QR code to the resource, the larger resource guide that people can use. Okay. That's kind of what I'm thinking, at least for now.
That's great.
Any other questions? Gabriella has done an amazing job this summer. I was able to go to a food pantry, the Westboro one, which was quite impressive. And it's been a pleasure working with you. I'm sad that you're going to be leaving us soon, but you're always welcome.
Thank you.
And another question I had, Gabrielle, is as you interacted with the food pantries, did anything click or any thoughts come to mind about how we can cross promote public health as well as the food pantries? I'm thinking, I know in Northborough, I believe in the past, we give them our flyers on immunization clinics or other things like that that may be coming up. Did you hear any interesting stories or talk through better ways where we could partner with them?
Yeah, I think that So for the different food pantries, they definitely seemed, at least the people that I spoke to, they definitely seemed open to it. Most of them did have community resource kinds of boards where you could put up like immunization flyers or posters about community events. I did tell everybody that I was working on this guide too, and so I want to be able to circle back and share it with everybody that I spoke with too, so that it could be promoted there as well. So yeah, I think that at least that was the general sense that I got from the conversations that I had, that people were open to it. And so in the future, I think it would be good to set up some conversations on how we could broker that relationship too.
Great. Well, thank you. So if there's no further questions, Gabriella, thank you for taking the time, and maybe if you can hang out for a little bit, but we all know you have to run, and so don't feel, I know you have another thing coming up. So thanks for making time during your busy schedule. We look forward to these materials. And do you think it's something that are we all going to see like a draft prior to finalizing it? Are you building it in like a Canva, or what sort of something that we'll be able to continue to maintain over time?
Yes, it's in the Canva account that Isabella has. I believe that you all have access to, and so we have a meeting set up to go through a full draft in the coming weeks, and I already have kind of a little preliminary draft in there, just kind of like a skeleton of what it's going to look like too.
Okay, awesome.
Thank you all.
I will circulate that.
Thank you.
Yep, of course. All right, ready to move on to community health equity initiatives. So I know I've sent a couple of emails about this. I just wanted to take some time in the meeting to discuss the survey. So it is called the Community Health Equity Initiative. It used to be called the COVID survey last year. So it covers a huge range of topics. It's basically a health assessment for the whole state. The survey, I did hear from their team today, their survey will be open until the end of October. It takes about 10 to 15 minutes to complete. It's in 9 or 10 languages. It's a great resource just for us to better understand what's going on in our communities and statewide. So again, the survey will be open until the end of October, and the data is hopefully going to be available pretty quickly. So late fall, early winter, and we will have all of the town specific data in a dashboard, as well as we'll be able to have the raw data. Any questions about the timeline for the survey?
I just have a question about, do you know, not about the timeline, but do you know what the response has been so far? Okay.
Yes, so here we go. So I got this email today. So these are the updated stats. So Boylston has 16, Northborough has 115, Southborough has 12, and Westborough has 29. The demographics is for our region. The grayed out boxes they can't show us because we don't have enough participants yet in that category. But so far we have, almost 70 older adults. We have a few parents with children disabilities, at least one disability. So you can kind of see the breakdown, and I can send this out via email as well. So definitely still trying to push this out to all the communities. They have a great promotional toolkit with flyers, email templates, social media posts, and they're coming out with new ones this week. And then I guess one question I had for the group, so it is a possibility to get written survey material, and I just wanted to hear everyone's kind of opinion on whether that would be worth doing. Basically what that looks like is I would have to sign their IRB to make sure like I remain confidential. We could then put out the written surveys. They would have to be given to me, and then I would have to input each survey. So I'm happy to do this if like the senior centers, libraries.
Right. Now that it's end of October, are there events that we could do this at?
Yeah, that is a good question. And we could also have like a stack at like a senior center or library.
Right. It might be appropriate for our senior center. I know I spoke with them, but I do think that our senior center would appreciate written.
Okay.
both my locations, I'm sure will be open to that, the library and the senior center.
Okay. Anything else? Any other questions about the Community Health Equity Initiative? So I will reach out to their EPI and get the correct paperwork for the paper surveys, and I will start distributing that as soon as I receive it.
Thank you. No, on a sort of related note, but a different survey, the Metro West region, what was that one looking at? The Metro West region one. They said that would be ready end of September.
I haven't seen those results published
Right,
yet.
they're
I
not
can-
ready yet. No, they're not ready yet. They said very end of September. But will that complement some of what that's surveyed here?
I think so. Yeah, I
Mhm.
don't know. I think Northborough and Southborough and Westborough had quite a good response, Kristen, if I'm remembering correctly, from Kate Baker. So hopefully when that
Yep.
data comes out, it'll complement this. It was a lot shorter, so it wasn't as
Yep.
in depth.
Yep.
And, I just want to say we were on another call with the PHE and they were saying how long it takes for individuals. So Isabella would actually have to manually enter all of that survey data. So we want to make it inclusive and we don't want to, not offer it to seniors. But if they don't have a preference, most definitely see if we could get a tablet or could we have them do it on a computer. The paper is sort of for those that will do it in no other way because it's just a lot of time. And, for people that really care about accuracy, they're really going to probably be the ones that want to take it in themselves. So when you send up the detailed information, Isabella, like I was just speaking to my librarian, if you could again, maybe highlight any of the social media toolkit links that would work well for the different audiences. Like we talked at our senior center about like a table topper, at the lunch tables, and our library, we're talking about maybe sticking a QR code like off the monitors and the screens. Like Northborough, there was staff that reached out to Isabella and said, what did you do in Northborough? How did you get 100? And we sort of went, we don't know. So did you get to the bottom of that, Isabella? Was that like the senior center? I'm thinking maybe
No
they
idea.
put it in a newsletter. If we find that out, I'll forward it to you guys. I know Jen in Westboro, they just did a really robust survey. So they might have some survey fatigue in Westboro, but it's a good opportunity. And I was talking to my librarian on another project and she was excited over the data. She thought it might be helpful to the library as well as they're getting more involved with trying to promote, health and wellness initiatives and resources. So.
Absolutely. And I think this is the first time they're opening it up to 14 years old and over. So right now, obviously we have a very small population of youth and young adults. So if we can think of, I know they do the Metro West survey, so I'm not sure they could really push it out too much, but just keep that in mind that kids can also take this. And their goal is to get a few thousand children. So they're definitely not going to stop until they reach kind of their quotas.
And any idea if the incentives the state's talked about would apply to our communities, like gift cards to kids or any incentives locally that we'll see in Greater Borough?
So we can use PHE funds to incentivize for this survey if we want.
Any guidelines around that?
In the meeting today, they said they would send them out this week.
I don't know where we are in the PHE budget. We can look at that. The contact tracing budget, we're gonna have plenty of money. So if there's the flexibility on that, we could talk again, with health directors and see. I mean, it's fun to get, everybody loves a gift card and I'm sure we'll have some limit of no more than whatever. We did gift cards recently with substance use prevention work. We were doing youth risk surveys in the schools and we gave like $25 local gift cards and the kids were like beyond thrilled, and it got them a little engaged to know about your organization because you just bought them a free coffee and lunch and whatever else. So that's something we can throw back to the group if it's an allowed. I mean, I don't know, by raise of head, like nods, if we have money that we know we're probably not going to be able to spend on contact tracing, are you guys supportive of trying to look into gift cards that we could give out to certain populations for targeting? I'm thinking in particular the schools.
The youth, yes.
I don't know if you can do that.
And why are you worried, Chelsea, from because the school, is it something particular, the students? I mean, I'm thinking like young adults.
I mean, I just don't think you can use public funds
For gift cards?
for gift cards. Like, I'm just thinking, I'm thinking of an issue that I dealt with last year related to getting a donation for something and then a committee using it to promote people to do surveys. I don't think that you can use funds that way.
Okay, well, we'll take our guidance from the state for sure. You know, they
Yeah.
said it on a call this week.
They did?
You know, yeah. And then in previous, I'm trying to remember, like COVID vaccinations, the state was buying gift cards and giving them out. So anyway, we'll definitely, we'll connect with all of you if it's supposedly allowed by the
Okay,
state.
yeah,
And
we
every
definitely-
town's rules may be different too. So I don't want to I'm not looking to violate anything.
Okay,
Good point.
sorry.
No, I don't want to break rules. I mean, there may be other ways to get incent. I think it's always hard getting that, like a 14-year-old would do a 10-minute survey. But if you have other ideas or PTO, or maybe like it's easier to have a volunteer donate or a business donate and sort of do a raffle. But again, there's really no way to police to know that they did it. So we'll have to see. Maybe it's a health class thing. Maybe it's more that Mary Ellen dug in, like in our schools. Or Westboro, I don't know, Jen or Anne Marie, what you could do in your schools, but sometimes a health class might be willing to let their students do that during health class. Or some other class, you know, so, okay.
Perfect. If any questions come up about the survey, let me know. I will reach out about the paper survey and then any guidance I receive about using funds for incentives. And just want to stress that this would be a really great opportunity for our region because we wouldn't have to spend money to do a huge community health assessment because they're doing it for us. So hopefully we can just like increase the sample size. And with that, we will go into Erin. Vaccines.
I'm just going to talk a little bit about the upcoming flu vaccine or the flu season and the vaccines that we have. I know Westboro and Southboro are planning some things as well, and I can particularly speak for Northborough and Boylston, but we have access to the standard dose flu only. We were trying to come up with different ways to see if we could get some funding for the senior doses, and unfortunately we weren't able to. So I'm working with Wegmans. I actually just got it confirmed this morning that they are going to come out to Northborough Senior Center and be able to offer the senior dose. I know Southborough does purchase it. I'm not sure if Westboro has it. And Boylston, with so few people coming out for the flu vaccine, Wegmans wouldn't be able to come out to Boylston specifically. So my plan is just to offer that clinic for both towns. So as soon as I have the link and information from Wegmans, I'll be able to share all the flyers and all the information so it all goes out at once. So I'm hoping to have that fun. Fingers crossed. The reason for that is I guess I should mention that the CDC last year recommended that 65 and over. It is recommended for them now to get a senior dose of flu vaccine, where before it was an option, but it wasn't necessarily the recommendation. So that's why we're trying to get creative in other ways to make that available.
Our senior center director actually purchased 100 senior flu vaccines for us.
That's what I thought I had heard for Jim, but I didn't want to speak for you or for him in case I had some of the information not right. So that's amazing.
Yeah, that was great collaborative.
Yeah. I
And
should
Jen,
be there
do
to
you know
help
how
him.
they paid for it? Was it just out of their budget, or how did they do that?
Yes, she has a huge budget that has often line items that aren't used. So she just used that money. And but she also has a lot of seniors leave her money, lots of money, and then she has total authority over it, believe it or not. And she can choose how it's used. So that's one of the ways she could have done it. So it's either way.
That's great.
Any other questions about flu?
When is the flu clinic in Boroughs in Northborough?
The drive-through clinic is going to be on Saturday, October 14th.
And is that open? I mean, it's the standard dose, like you said, not the high dose, but is it
Right.
open to
Right.
anyone in Boroughs?
Yep, that is it's ages 6+. Like you said, we're not offering the senior dose. Usually is Northborough, Southborough, but
I think last year we did Northborough, Southborough, and Boylston.
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 We ordered, that's what it was last year. So
Yep.
like based off responses, we ordered the same amount. We didn't assume it was going to be higher or lower. So we're holding those 500 doses for that event.
Okay.
Well, yeah, and it's potentially 500 for that event. That cuts into the other events that we have are included in that.
And Boroughs is doing homebound flu?
Yes, I know that we've started some initial planning here with Penny, trying to start compiling the list of people that were seen last year and working with the senior centers and to try to see what the level of interest is, especially for, I know Southborough, Taylor does order some senior doses, so that's all kind of factored in, but but us only having the standard dose, making sure that they're aware that that's what we have to offer, but we could come into the home.
I don't know if that's the time to talk about this one.
Yeah, I was just thinking that there is a program that we have, and we do have the information on it. There is free in-home COVID vaccines. Basically, there's a QR code, there's a sign up, and somebody else comes out to the home. Some of the seniors in Northborough have done that with Penny's help over the summer as they were looking for a COVID vaccine, and it's worked out really well. The feedback has been great. She did just call the other day to see if they would do senior dose, and they're not currently doing signups for the COVID vaccine right now until the new vaccine comes out and things kind of get ironed out with that, but that would be an option for people at home as we have questions about COVID vaccine.
And I think, yeah, Penny's experience was very recent. And it sounded like it was a great experience. So, but we did call them, they will not do flu. So it's like a COVID only. So it's mass.gov. Vaccines at home is the website, but they only do COVID. So we will figure out flu with our, visiting nurses, and then we'll direct people there. So although we're not doing any COVID-19 clinics, even pharmacies right now, it's a slow deployment because many of the health insurers haven't yet approved it. So I talked to a pharmacist friend, and, individuals that were straight out of the bat and didn't worry about coverage were paying $191 a shot. So for the average resident that wants their COVID-19, they should probably wait. Those approvals from insurance companies are coming soon. But if you run out right now, you could be sitting on a very large, uncovered cost of $191 for a COVID vaccine. So stay tuned on that. And then what we're planning to do, although we're not running the vaccines, we'll make sure to definitely push out messaging. So we'll work on some Canva Facebook posts to share, maybe a QR code to just which local pharmacies in our 4 towns are offering the vaccine with the direct link to schedule. So I think last time we just tried to make it easy. One thing we did in Northborough, right? If it's a senior and they want homebound, we'll push them to this direction, or if they need help registering, they could do it through us at the senior center. And the same with flu. Like we've even say to residents, they're just having trouble. Like, we're not offering the clinics. I know you're upset to hear that because you're used to coming. If you want help scheduling at a local pharmacy, we're happy to assist. So we'll try to, again, compile that once everything settles out so we can try to push that out uniformly. And I guess, Heather, so we're on immunizations. I know you wanted to talk a little bit.
Well, I agree with what you just said. All that Metro West, the Health Foundation is keeping stats on our region. So our region is for seniors, which I think, for prevention of hospitalization and death, the key areas for our seniors, 75 plus, Northborough is 63% as of September 6th, which is the lowest in the Metro West 25 towns that they want. Westboro 65, Southborough 74, Boylston 76. So, and the range, they didn't give an average, but the range in our region for the 25 towns, Metro West is 63 to 96. So same in Southborough, we don't have money for COVID vaccine clinics. And the Metro West Health Equity said that basically when I spoke with them, we could potentially qualify, but you don't get money on the fall round till January 1st. So we're not going to apply for that. So I would agree in pushing out the messaging and assisting with scheduling.
Are there any other questions around immunizations, either flu clinics or COVID-19? Okay. We'll keep moving through that agenda. Isabella, next I have up is our substance use prevention work, specifically opioid settlement funds in Central Metro West Substance Awareness and Prevention Collaborative. Did I say that right? I'll hand it over to you, Isabella.
I don't have too many updates for this. I just kept this slide just so we could talk about any ideas people have. But this flyer to the right is some regional webinars that will be helping municipalities, connecting municipalities with people who are most impacted by the epidemic. So there's one tomorrow and there's one on the 28th. So they said you don't have to go to your specific region. So that's a good resource for those who are interested. Kristen, do you have any updates about the opioid funds?
No, I did attend that meeting. I don't know if any of you were on the meeting yesterday, and it was just general about soliciting input with those with lived experience. So, I mean, I don't think I heard anything new that we sort of haven't heard, other than obviously the state has hired JSI to act as a consultant to municipalities to solicit input. And, you know, just from my personal experience, there was like a link that went out from DPH at a recent local board of health call. So I did request a consultation. So each town can separately reach out to JSI and request a consultation to talk about ways to solicit input in their community, and also possible ideas with projects and things to collaborate on. So again, that's, I think I'm scheduling that for next week sometime, just a basic phone call with the JSI consultant. So yeah, we still in Northborough, I could just say from our side, we still haven't gone through the whole soliciting input. We're sort of leaning towards more of like a general, like online survey and business card and mailing, that sort of thing. But we're dealing with a change in administration. So things are moving slowly on sort of those bigger projects. So no more update for me on opioid settlement. I don't know if anybody else wants to talk about what's happening in their community, or if you've solicited input to check that box yet for those opioid settlement funds. I know Southborough's still waiting for a town meeting in the spring, so you guys are in a holding pattern. So, all right, no more updates there. We can sort of keep it as a standing agenda item with this group if that's helpful. Obviously, we only meet quarterly, so we might all have more updates by then. So we'll keep that going. And then do you want to talk about CMSAPC quickly, Isabella?
Sure. So this is the regional collaborative headed by Hudson. So Lauren, Shannon from Southborough and I actually went to their recent kind of action planning retreat, and we sat with Westborough. So that's great. And it was just a great way to just collaborate and talk through with Amanda Decker on how to work with the region. So there is going to be another meeting. I'm not exactly sure when. I can send it out in the follow-up. So we can, stay involved in that and get ideas for our opioid settlement funds. Does anyone have any questions about that group?
Okay. All right. Next on the agenda is, yes, our open meeting law, Public Health Excellence Collaborative. So alternative posting method. It's so fun to try to post an agenda on time across 4 communities with different staff and vacations. You don't necessarily who's around and who's away. We were on a recent PHE meeting and we had this aha moment, and this was presented to us from DPH. They said there's actually 940 CMR 29.033 actually allows for regional groups like ours to adopt this posting process. So we only post our meeting agenda in one town. So it eliminates, so if many of your towns might have a collaborative like veterans or other groups that are multi-town, thinking mosquito control boards, or, so your town probably is already using this. I did speak to our town clerk, Andy Dowd, who's very experienced. I said, Andy, is this legitimate? How would we do this? You know, exactly what would the motion look like? And, you know, he said, yeah, Kristen, that makes sense to me. Just at this meeting, as we were informed by the state, we would just need to formally adopt it. So I don't know if you want to take a minute to
So-
read over that slide from Isabella or ask questions.
Oh, no, I don't have a question. I want to make a motion to accept the host town to post the agenda only.
Yes. I don't know. Are you guys familiar with this in Southborough, Chelsea? Like-
No, so I just was gonna ask a question if that's okay.
Yeah, go for it.
So how does this work for meeting minutes affiliated with that agenda?
So I'm sort of reading through it too. Like, I don't live in this world. So I
Well-
think all of it, you know, right now we post all of the meeting minutes. So we would say the
Mhm.
official posting is the town of Northborough. We do it off our website, which is great. Everybody should have access. The minutes are also posted, you know,
Right.
to that same landing page. So I would think it would carry on to the minutes as well, but I think
It does.
we could follow up to get an answer. I think for posting agenda, that's the hardest part. Posting the minutes isn't the hard part, right? It's always just trying to make sure everybody's met the 48-hour rule.
The meeting follows the agenda, the meeting minutes follows the agenda. So the meeting minutes you posting on your site would cover posting meeting minutes.
Yeah, I'm not familiar with this, but that doesn't mean that we're not doing it somewhere else that I'm just not aware of.
Mhm. Yeah, my town clerk like didn't hesitate. He's like, nope, you know, because it's referring to Mass General Law. Isabel,
Yeah.
is the next slide the actual motion that Andy recommended?
No, I can look at his email, but he,
I can pull that up now. You guys finish reading through that long bulleted slide. Okay. So, oh, we don't have chat because Northborough's disabled that. So, so Andy, our town clerk, informs us the motion should read to adopt the Greater Boroughs Partnership for Health's host district website, which is www.town.northborough.ma.us/Greater Boroughs Partnership for Health Advisory Board as its official notice posting method.
I second that motion. Since you read it, I don't have the ability to read it, so.
You could say so moved, maybe.
So
I don't
moved,
know.
yes.
Yep. So that will be my motion. I just read it. Jenna seconded that motion. Any discussion?
Can we get a copy of, there's the part about the participating municipalities have to post about the PhD collaborative and information on the host website.
Now, this doesn't stop you from posting on your page. So you can always still do that, but you can opt out by using this as a means. Just so in case no one was aware of that.
Okay. So I'll work on that notice. If this were to proceed, I'd work on that notice and then circulate to everybody. And we'd also have to send it to the open meetings at mass.gov. So Northborough would be responsible for that. Okay. A roll call vote. So Kristen Black, aye.
Jen Sullivan, aye.
Heather Alker, aye.
You're next, Ann.
Aye.
Okay, that was Anne Marie. Okay, thank you. Let me get back to our agenda here. Approval of the meeting minutes for June 14th, 2023. Those were circulated by Isabella. I want to make a motion to accept and then we can discuss.
I make a motion to approve the minutes from the June 2023 advisory meeting.
And I'll second that motion and discussion. Okay, no discussion, so we'll do a roll call vote. Kristen Black, aye.
Jen Sullivan, aye.
Heather Alker, aye.
We didn't catch that. Anne, can you just say it one more time? Okay. Again, your audio is not coming through. Anne, can we get a thumbs up for, are you approving the meeting minutes? Okay, we got a thumbs up. I think if you could read lips, you could see that, but I couldn't get to. Thank you, Emery. Next up, just to confirm our future meeting dates, we have December 13th, March 13th, and June 12th. So those invites should be there in the calendars. We'll double check on that. We'll continue to meet, or actually with our December 13th, hitting the winter holidays. Would you guys like to meet in person? Because it's been a while since we've done that. I'd be happy to volunteer the Northborough Senior Center for an in-person meeting. Or any other
I'm
thoughts?
afraid of where we'll be then. So I don't know if it's conducive to actually being able to meet on site.
Any other thoughts from anyone
I
else?
prefer Zoom, but that's
Okay.
just my opinion.
This time's just tough for me to be in person just because of pickup,
Okay,
but I could do 2 to 2:30 probably and get back here.
okay. Well, if it's tough on timing, we can always touch base closer too, but there are a lot of moving pieces in our town's public health departments right now, so we can be respectful of that. So we'll stick with, for now, Zoom. And then is there any questions or any other business to come before the board? Okay. Jen, I know, go for the motion, Jen. I know you're waiting.
I move to adjourn the meeting at
Sec-
2:46.
Okay, great. And Heather seconded
Second,
that. Okay, and we'll need to do a roll call vote. I'll go to you, Jen.
Jen Sullivan, yes.
Heather.
Heather Alker, aye.
And Anne Marie is giving us a thumbs up right now because they're audio. So thank you, Anne Marie. We'll count that as an aye. Kristen Black, aye. All right, thank you. Thank you especially Isabella for keeping all the slides going and coordinating and posting. She's really taken all the lion's share of the work on that. So thank you, Isabella. And
Thank you, everybody.
thank you for joining Erin and all the work on the flu clinics, all the rest. All right, thanks everyone.
Thank you.
Bye-bye.